Welcome back, everybody, to another Ask Dr. Jason. And today we're going to cover a very new topic, something that has recently been, you maybe have read about it, actually in the newspaper, maybe you even saw an article on the internet. I even saw it on the 10 o'clock news a couple months ago. But there's something that they're calling the new epidemic. They call it tech neck or text neck. So I had a patient come to me this week and they had asked me, what is that exactly and why is it bad for your spine? Well, to answer that question, I'm going to use not only the spinal model here in a minute and hold it up to explain exactly what's happening, but I also am going to be using x-ray technology today to show you exactly what a normal neck looks like, and then I'm also going to show you what your neck would look like when you're actually looking down. So first things first, what is tech neck or text neck? Well, if you have a cell phone, you probably already know what this means. It just, you see it, maybe your family members or your friends are doing it, but everybody that has a cell phone, when they're texting, we all do this. And we're looking down like this. And so here's the problem. Not only is that happening with our cell phones, but we are putting ourselves in that position when we're sitting looking at a laptop computer, maybe even a desktop computer. We're also doing that position if we're a student. I remember my days back in college looking at textbooks. I would be constantly looking down at it in that same exact position. So even though I know it has like a really new trendy name, it's really nothing that's new. And let me just show you what's going on when you are in text neck, okay? And so here we have the spinal model. Now, if you remember, in an earlier Ask Dr. Jason, I had explained what a normal spine should look like from the side, but to briefly recap that, what we need to see is you should have a curve in your neck called the cervical curve, a curve in your middle back called the thoracic curve, and one last curve, your low back, the lumbar curve. Now, what is happening with text neck or tech neck is this. As this is a normal curvature in your spine, this is what we want to see. However, when you look down, you are doing this to your neck. You are completely reversing the shape of that curve. So instead of it curving up and backward, it's now rounding down and forward. And so let me switch into some x-rays here to help you understand, and you can see it on an x-ray, why this is a problem. And so here we have a picture of a normal x-ray. This is a normal cervical curvature. This x-ray is mine. I just want to let everybody know this is not from a patient in my office. And so there's two things I want to point out to you about this x-ray. Number one is the gravitational weight line, which is actually represented by the blue line on the x-ray. This is the center point of gravity with your head, where all the stress of your head is. So what we want to do with this line is when I draw that line, I want to see it going through the vertebrae. And so that lets me know your head's properly over the top of your vertebrae. Now the average human head weighs about 12 pounds, and there's a rule: for every inch your head comes in front of your spine, you put 10 more pounds of stress. And so number one is, if you have your head over the top of your vertebrae, you're going to have less stress on your vertebrae, less stress on your discs, less stress on the nerve roots, and also less stress on your muscles holding up your head. Now the second thing I want to call attention to on this x-ray are the red dash mark lines. If you see how those are, the dash marks line up, it forms a curvature. That is the cervical curvature as well. The cervical curvature is very important because your spinal cord runs down the back side of your vertebrae through the spinal canal. And as long as you have a nice curvature, there will be no tension, no extra stress on your spinal cord. And so next we have a x-ray of me looking down toward the floor. And this is the same thing you would have if you were looking down at your phone. And so again, as you see this, you can obviously see there's some big changes in my spine when I look down. Let's start with the gravitational weight line. So again, now that weight line, the center mass of my skull or my head, is way out in front of my spine. So in this particular example, I'm probably loading between 30 to 50 extra pounds of stress based on laws of physics, not only on my spine, on my discs, on my nerves, but also putting that extra stress on my muscles. And so number 2 is when you look at the red hash marks going down the back of my spine on this example as well, you will see there's no longer a nice curvature going up and backwards. However, now it is going forward. It's completely reversed. So this will cause tension on the spinal cord, and this is something that we absolutely do not want to have happen. And so between using the spinal model today and showing you these x-rays, I just wanted to show you what exactly is happening to your spine, maybe it's your children's spines, as they are constantly looking down at their iPods or iPads or whatever it may be, their cell phones. And so what are some simple solutions that help this? Well, the easiest solution is this. Take your cell phone and raise it up so you're not looking down as much. That's really one simple solution. However, here's a problem, is if you have been doing this for a long enough period of time, as you look down, you are overdeveloping or strengthening your flexor muscles in your neck. Now, if these muscles are too tight, you are actually going to pull that curve out of your neck permanently. And so again, the other way that we help people with this condition is not only change their postural habits, but chiropractic care in the office. So we need to actually take care of the spine through chiropractic adjustments. We do cervical traction. We do other postural exercises to help reduce the damage, to help put the curve back into the spine. And so again, I want to thank you for that question. Ask Dr. Jason. If you have any questions at all, leave us a comment on our Facebook page or on our YouTube page, and we'll try to answer it. Thank you very much.